Welcome to Hiranya Medical Service.
Hello, this is Dr. Gautham, and today I'm going to talk to you about how the mind works, where it is, and how it breaks down. Now, the brain is made up of a network of millions of cells. Each nerve cell is connected to many other nerve cells, and there are 100 billion nerve cells which are organized into various circuits. The circuits are nearby circuits, local circuits, wide circuits, and far-reaching circuits throughout the brain as well as throughout the body. Now, these brain circuits produce thousands of impulses within the brains. So the cells are connected into circuits which produce impulses, which produce all the thoughts, actions, and feelings which we call the mind. Each brain cell sends an electrical pulse down the axon, which connects to the next cell and transmits the information to the next cell. Now, a puff of chemical transmitters is released from the first cell into the second cell, and the information is transmitted that way. So these billions of nerve cells organized into billions of circuits send out billions of impulses through billions of chemical transmissions at every microsecond. There are more than 100 neurochemicals which are responsible for producing these thoughts, actions, and feelings. Now, thinking, feeling, and action are therefore produced by these nerve circuits. And so the mind is the software in the hardware which we call the brain. Now, the brain is manufactured by genes in the womb, and the genes also program the mind. So the genes decide how the brain is wired, which wire goes where, how the wires are interconnected, how these wires are organized into circuits, which circuits are connected to which stress sensor, and how each stress sensor responds to stress. So any fault in the genes produce faulty wiring. Now, everything that we experience every day, whether it is an external experience, a social experience, a family experience, or coming from within the body, whether it is any pain or any feeling of illness, all these are only triggers which trigger the genes to produce these thoughts and behavior. Now, each circuit has a voltage stabilizer built into it. When stress overloads the circuit is stabilized and returns to normal. Now, the mind is like a suspension bridge. The normal mind can take both light and heavy stress. So there will be a healthy personality with no faulty genes or very few faulty genes, and the circuits are normal. So this is what we call the normal mind. Now, in the sensitive mind, there are a few faulty genes and a few faulty circuits. So this mind can take stress easily, and symptoms may develop when the stress builds up and becomes heavy. Now, the symptoms of a sensitive mind are a person who easily gets upset, easily worries, who has daily stress, is upset with problems, and has emotional swings, but quickly returns to normal. Now, in a susceptible mind, there are many more faulty genes, many more faulty circuits. Now, this mind can take light stress, but sometimes even light stress can produce symptoms, and heavy stress definitely will produce symptoms. So the symptoms of a susceptible mind are negative thinking, unwanted thoughts, unnecessary thoughts, decreased work performance, anger, anxiety, disturbed sleep, tiredness, problems with appetite, confusion, and so on. Now, when there are a lot of faulty genes, and a lot of faulty circuits, the mind begins to break down. Light stress also produces symptoms, and heavy stress produces breakdown. Now, in the breaking mind, the voltage stabilizer fails. Excessive load leads to overloading of the circuit with a breakdown. So, the breaking mind can be identified by uncontrollable thoughts, uncontrollable anxiety, crying spells, depressive thoughts, inability to work, panic, aggression, inability to sleep, mood swings, excessive happiness, excessive spending, and sexual disorder. And ultimately leads to mental illness with hallucinations, delusions or false beliefs, violent behavior, abnormal behavior, and different behavior. So everything that we experience on a day-to-day basis is only a trigger or a modulator for the genes. So our experiences turn the genes on or off, and whether the genes are on or off decide the behavior that we undertake. Now, the treatment for mental disorders is what I call chemical surgery with therapy. Chemical surgery is done through medicine, which stabilizes the nerve circuits and relieves the symptoms. Medicines need to be continued to prevent irritability and loading and breakdown in the circuits, even if there are no symptoms. Medicines are required to stabilize the circuits, only then other techniques will work. So once you give medicines and open up the mind and stabilize the circuits, then you can undertake lifestyle changes, yoga, prayer, meditation, counseling, or family therapy, which will cure all your mental problems and disorders. Thank you.
Thanks for watching. Do like, share, subscribe, and click the bell icon button to receive instant updates.